What's up? My name's Emily Knife, and I'm the Dean and Professor of the School of Modern Nursing. And I'm so excited that you've taken interest in the Somatic Nursing Certification. And that's what we'll be talking about today on this Q&A with me. So let's go ahead and begin. All right, so Somatic Nursing Certification, that is why you're here. That is why you are watching this recording, because you took interest in modern nursing, in a different way of nursing, and really looking at clients' root causes of what's going on within their body. So let's go ahead and get started here. So welcome, welcome, welcome. Again, thank you so much for being here and taking interest in this. This is a dream of mine that had come up in a meditation, and I figured let's just go with it. And it's just developed into a really cool field of nursing that focuses on neuroscience. So we're going to talk about today, what is somatic nursing? We're going to talk about the certification outcomes that you'll achieve when you get certified and what you can do with that certification. We're going to look at the curriculum and what the curriculum looks like for somatic nursing certification. We're going to also talk about the support and mentorship within the program that is offered after you are done with your 6 weeks, and the investment for somatic nursing. So, what is somatic nursing? What is this new field of nursing that you've never heard about? Well, somatic nursing is a focus on nervous system. And what I've come to find in working in hospice, case management, home health, pediatrics, and all the other fields that I've worked in, what I found is a lot of the time our diseases and disorders are directly related to a dysregulated nervous system. Yes. So, like the number one killer in America is heart disease. That is directly related how you handle stress, which is in direct relation again to our nervous system. So, a lot of the root causes are related back to our nervous system, which is really cool. And so the focus is going to be more on the neuroscience and the nervous system, which, if you remember in nursing school, we only learned really about the cranial nerves, right? Do you remember the face and all the numbers that were drawn on it for your NCLEX? That's all I knew about the nervous system until I started diving more into the field of neuroscience and somatics, and even quantum physics for that matter. So, what we'll be using is evidence based research in neuroscience, and a lot of the focus is using dialectical behavior therapy, or also known as DBT. Marsha Lindhan, super cool chick, actually started DBT because she found that her own mental health was not being supported fully by traditional therapy. So she invented DBT. And DBT has 4 components, and we dive more into those components in the certification. And you actually become very DBT skilled aware, and you'll also use this in your own life as well. So we actually learn a lot about ourselves in the somatic nursing certification. Our focus, though, is to provide somatic body education to clients, students, and employees. And well, why is this so important? Because, like I said, a lot of our chronic conditions or even our mental health disorders are related back to a dysregulated nervous system. So, if we're able to help somebody get that nervous system regulated and under control, then other pieces of them will start to flourish and they'll actually start to heal from maybe a chronic condition that they're experiencing. We're guiding clients to root causes. So, in traditional nursing, is usually medication based with symptom awareness. So you have a client come in or a patient come in and they're experiencing chest pain, and automatically, instead of thinking about anxiety, you might think of a heart condition or a possible heart attack is going to about to happen. So we have to look at the symptomology. In that sense of chest pain, we automatically give that patient a medication to resolve that chest pain, which ultimately resolves the anxiety as well. But looking back at that, why did that chest pain happen? What was the root cause of that chest pain happening? Was it heart problem? Was it anxiety? Was it anxiety that was causing the heart issues? So looking at the root causes of why things are happening in people's bodies can really give them a good insight of what habits, addictions, or even consistent traditions that they're using that they might need to adjust. So we reconnect people back to their body with awareness and insight. It sounds pretty simple, but it's very intricate. And there's so many pieces of our body, but they're all connected. And when we start to look more and more at the nervous system, we really realize that it's kind of the main component of our body. And many of our actual body mechanics runs off of our nervous system. And whatever state our nervous system is in, our body reacts or responds to that. Where are somatic nurses going to be? We're going to be everywhere. We're going to be in hospitals, we're going to be in schools, we're going to be in corporations, we're going to be in companies. Where are employee wellness? We are helping regulate nervous systems. This can help companies cut insurance costs because they'll have healthier, weller employees. If everybody's nervous systems are in check, can you imagine how many diseases and disorders would really go away? I can. And I've seen it firsthand with my own clients. Our certification outcomes for the somatic nursing program in the School of Modern Nursing uses knowledge to either enhance your current practice or use it into your own practice and starting your own practice of somatics and seeing clients for certain things. For instance, most of my focus on somatic nursing when I see clients or students is focused on emotional regulation. So I have a lot of clients that might have suicidal ideations, even plans for suicide, or just really dysregulated emotional nervous systems that they feel overwhelmed much of the time. Or, that interesting diagnosis of ADHD. Well, we really get to the root cause of that and understand that our body needs to move. And maybe the job that they're currently in doesn't suit their actual mental and well being. So, even changing careers, somatic nurses sometimes help clients get out of different relationships, different careers, and really start to dive into who we are as beings and what we need and what we want to help our wellness and our mental health flourish. We also look at starting to advocate, to be everywhere. Somatic nurses are really going to change the way that nursing is done as a whole and incorporating more somatics into the ICU, the PICU, maternity, into dermatology, whatever your field of nursing may be. Introducing somatics to clients can help them become better, even in just one session of helping somebody go through a 4-4-4 breath work. They will use that in the future. They will remember you as the nurse that taught them how to breathe, when so much of the time we don't even notice our own breath. You're going to become so self aware that things are going to happen and things are going to change in your life. You're going to start to notice things, as well as when you learn somatic nursing, change happens within you, but it also happens within your clients that you'll be teaching. Having this insight teaches you what you want and what you need. It not only improves the relationships with yourself, but improves the relationships with others. You become emotionally regulated and you learn the root causes, the actual medicine that we need is our own medicine internally. What we have our own medicine within inside of ourselves, and somatic nurses help clients get there. What does the curriculum look like? I'm going to dive into the website here in a second, and you can see more of the curriculum that we'll be getting into in the somatic nursing certification. But our main components are Somatics 101. So a basic somatics class course. This module focuses on what is somatics, what is nervous system regulation, what is the neurolinguistics of how our brain is firing, what does that look like? We're going to dive more into that, more than you learned in nursing school about neuroscience. We're going to look at awareness of self. What does that look like? What do your emotions look like within your body? Can you maybe root and reroute some of these emotions so you can possibly respond to them instead of react? We're going to look at root analysis. And I love root analysis because it really gets down to pinpointing what is some of the cause of these chronic conditions, such as heart disease or even diabetes type 2, arthritis, IBS, or even chronic mental health conditions such as bipolar depression or even anxiety. So, looking at these root causes, we start to dive into humans' habits, behaviors, and addictions. And many of the time, those three are rooted in our root cause. And if we start to look at those surrounding three habits, behaviors, and addictions, we can really start to investigate what's causing the person suffering. We're going to look at neuroplasticity, woo, and mindset, two of my favorite topics to talk about. Because our brain is so powerful, you have the opportunity to reroute and to recreate routes of mindset. So, if you've ever heard somebody speak very negatively about themselves, or even ourselves, sometimes our negative self talk can get in the way. Those are routes that neurons are taking, and they're firing in the same route. And until you change that route or the way that you have been thinking, you're going to continually think like that. And although at first it might be hard to start interjecting some positive statements, as you know, with habits, behaviors, and addiction, over time, your new neural pathways will start rerouting those negative self talk. And a lot of your self talk will be more positive and more hopeful and more opportunistic. We're going to also look at somatic practices and modalities and how you can infuse those into your current practice or start your own practice with clients. So let's go ahead and look at the support and mentorship. And then I'm going to go ahead and bring up the actual curriculum and we'll dive more into that so you can see what's really involved. The 3-month Modern Nurse membership is actually also included with your 6-week certification. So even after your 6 weeks is done, whenever you get done with that, you have 3 months of the Modern Nurse membership free, available to you to dive into community, to take some somatic classes, to do some live role plays. Whatever suits your needs, we have them available in the realm of somatics. So make sure you understand that you're not going to be left hanging. We don't just cut you off at 6 weeks and say, peace out, we'll see you later. We actually help you understand how to incorporate somatics and are available for any questions or concerns that you might even have of opening your own practice. There are worksheets and there's also a workbook that goes with our somatic certification. So you can also access that and use those worksheets for clients or yourself. We'll have a community chat and on many topics that we'll be discussing in our Modern Nurse community. We have live role play and issue resolving. So you have a client that has an issue and you weren't able to really get anywhere with that client, or maybe you're stuck and trying to figure out where to go with a client. This is the place to do that. And we'll have many conversations of how to help clients in a different mindset. You're also going to gain a community of like minded nurses. There's a lot of modern nurses out there. We need to start getting together and start gathering ideas and mentorship and community so we don't feel so alone. So I'm excited to open up this community of like minded nurses that can be a place of support and also networking. Let's talk about the investment of the program. So, the investment of the program is a huge investment in yourself. This program actually is to serve you first as a nurse, and then for us to serve clients. Because when nurses are emotionally regulated, we're way able to serve our clients in a higher capacity and a higher frequency. So, an investment of self and understanding our own ticks and tricks and triggers, and what that looks like in a form of healing and wellness. You're going to gain skills to enhance or start your own practice. All nurses are welcome, from LPNs to ADNs to DNPs to PhDs to BSN to MSNs. All nurses are welcome. All that we ask is that you have a nursing license. The certification is 6 weeks. At the end, you get a certificate from the School of Modern Nursing that states you are a somatic nurse and that you have been trained in somatic therapies. The investment is $1,999. This is a very small cost to how much you will be able to do with a somatic certification investment. With this investment, you'll be able to help thousands and thousands of patients actually become better and maybe even get off medication. So, this certification will not only enhance your own practice, but will enhance your own self and may lead you to opportunities that you didn't even know existed. So let's go ahead and look at more of the curriculum. All right. Let's go ahead and bring this up here. All right, perfect. Okay, so this is the course curriculum. So let's go ahead and dive more into those 5 areas that I just spoke about. So when we're looking at Somatics 101, we're looking at emotional words, body sensations. We have lots of worksheets in here. We're having live video sessions. So a live session in Somatics in action. We're going to have a 30-minute guided somatic session by myself, mindfulness of the wise mind, thought diffusion, willingness versus willfulness, which is a very interesting concept. We're going to look at the vitals of to success and the police skill as well. This is a hybrid course, so it is live and also recorded. So if you're unable to make any of the live sessions, it is also recorded. So we have that available to you. The awareness of self. So we're looking at root mapping, root causes, and this is a guide that helps your clients and even yourself understand what is the root cause of the problem at hand. We're going to self map and look more at DBT. So, a lot of this awareness of self is going to dive more into the emotional regulation and the DBT side of things. We're going to look at distress tolerance and what a live session looks like in dealing with somebody that might be having suicidal ideations or a plan, levels of validation, and even body scan meditations. For root analysis, habits, and behaviors and addictions, this module is a little bit longer, but we're really diving more into the main component of what you're going to be looking at with clients. And so many of these are DBT skills, but we also have creating environments for safety and safe space visualizations. We're going to look at addictions and somatics, acceptance mindset, and even strength from trauma. So, somatics actually is one of the number one modalities to help and treat trauma, which many of the patients that we see already have trauma. They might be going in for a knee surgery, but maybe they've experienced trauma within that knee. The neuroplasticity and mindset piece, we're going to look at coping ahead of time. So, how do you get patients to understand their nervous system and look at different skills to help that, such as give, fast, dear, man skills, all DBT based? Looking at nervous system reactivity. How do we respond? How do we react to certain situations? And those are most of the time habitual things that we've learned from our parents, our caregivers, or even our teachers. We're going to look at a neuroscience and its links to disease as a live session. So, this will be a live session, obviously recorded for your future usage. We're going to also look at insight of self. And last but not least, the somatic practices and modalities, looking at the somatic practices and how you can infuse those into patient care, communication and somatics, environment and somatics of self. We're also going to have a live somatic session, and also a list of somatic practices are involved in that last module. So those are the various modules that we have, and also integrating it into your own practice, right? So starting your own practice, integration into different fields of nursing, such as bedside, maternity, mother baby, nursing education, and the integration of psychedelics. So potentially, if you want to get that in the future, we also have a microdosing course for nurses to understand psilocybin and how that can affect and actually help treat CPTSD, anxiety, depression, and all sorts of mental health conditions, which again might be related to a root cause of what's going on. We're going to look at the relationship of the patient and the nurse, and then also a one on one session as a somatic nurse with a client. And then we're going to dive into being more intuitive led. As a nurse, sometimes our intuition is a little bit blocked as we step into the hospital with all the sounds, the lights, the concrete, the noises. We get distracted from actually listening to our intuition and to our gut as nurses. And that can be very beneficial when we're helping people heal and tapping into our own gifts and awareness and allowing that to shine through to help others. So that is a little bit more of the curriculum. So diving more into that, you can really see there's a plethora of information there that focuses on the somatic body, becoming aware and gaining more insight. So I hope that was informational for you. If you have any concerns or questions, please feel free to reach me at schoolofmodernnursing@gmail.com. You can also go to the website if you'd like to send us a message at www.schoolofmodernnursing.com, or you can find me on the Instagram at School of Modern Nursing, and I will be happy to answer any questions that you may have. Until then, I hope to see you on August 21st. You can enroll now in the class. It is open for enrollment and it will be on the website. So you will be able to find a link there to sign up and register for the course. I will see you soon at the end of August. Thanks so much for joining me. And thank you so much for believing that there is more to nursing than just four walls. Take care and be safe.